Picture a future where mental health is addressed with the same precision and effectiveness as physical health. iFocus Health is making this vision a reality by introducing objective data to mental health care, revolutionizing the way we understand and treat mental health conditions, starting from ADHD. Hi, my name is Aditi Nair. I'm the CEO and co-founder of iFocus Health. I was diagnosed with ADHD in my 30s during grad school. A few years ago, my kid was also diagnosed. This drove me to the journey that led to the creation of iFocus Health. I know you must be very busy and I appreciate the time you're spending on learning about iFocus Health. This overview provides information about the content of this presentation and how long each section will take, so you can plan ahead and choose which parts are relevant to you. I will start with an overview of what is iFocus. Then I will describe how iFocus would work in a clinic setting and share some details about our pilot program. The last part will go into our study results and deeper dive into how iFocus works. iFocus was created by 3 dedicated women, each with a personal connection to ADHD. Einat, our AI expert, is responsible for transforming the data we collect into meaningful and useful measures. Ravid's superpower is to transform our technology and ideas into a product that is designed for people with ADHD and their clinicians. We're very excited and thankful to get support from leading clinicians and researchers in the ADHD space. You might recognize some of these names. What do? We realize that after a person is diagnosed, they hit the challenge of finding the right treatment. The burden of repeat follow-up visits and medication changes affects patients and clinicians. An effective measure of progress has to be tightly connected to real-life tasks. It has to be easy for patients to perform without disrupting their day. iFocus measures the patient's progress compared to their own baseline, creating quantifiable data that can help inform treatment decisions. How does it work? We're looking at the eyes when someone reads. This is an example of a high schooler who has ADHD. This is how they read without their medication. The red dot represents their eyes. See how hard they're working. Now with medication. You can see the differences, and why looking at reading processes is a good measure for improvement. The strength of our technology is that each test takes only a few minutes and is based on real-life tasks, like reading. After a person completes a session with and without medication, our system analyzes it and creates a score. Our report looks like this. The objective iFocus score is presented alongside a self-reported score based on input we collect from the patient after the test. A link to a video showing a demo of iFocus can be found in the iFocus exhibitor page. Till now we discussed the patient's experience. Let's switch to discussing how iFocus works from the clinician's point of view. This is an example for a clinician report for a patient titrating Vyvanse. In these graphs, higher is better. A higher score represents more improvement. The length of the bars represent the variation in the patient's scores. The graph on the left is the side effects. Higher is more side effects. You can see that for this example, the iFocus measured improvement is similar to the self-reported one. In both cases, a higher dose drove a higher performance. Naturally, there are cases when these two measures do not correlate as well. We can see patients who get excited about their medication initially, but then their self-report score goes down. Others are not so sure if they recognize an improvement. These type of results can be a trigger for a conversation between the patient and their provider. iFocus provides data to guide these discussions and reduces the need to rely on the patient's memory. With iFocus, you have quantifiable measures you can easily review, reduce the need for back and forth messaging or long discussions during appointments. I want to share a unique opportunity with you. The patient-facing part of iFocus was developed based on patients' feedback. Now we want to do the same thing for the clinician-facing part. So we created a pilot program. So what would it mean to be part of the iFocus pilot? We want to make this as seamless as possible for you. Our goal is to bring you value and get your feedback. When you identify patients who can benefit from working with iFocus, whether they're just starting their ADHD journey and trying their first meds, or changing their medication, or have any other concerns about the current medication. Send them a link and a short paragraph describing iFocus. This information will be provided when you join the iFocus program. The rest is on us. We support the patients, remind them to do the tests, and provide them and you with reports according to your needs. Our goal in this partnership is to get feedback that will help us create a product that brings value to clinicians like yourself. We ask you to get at least 5 patients to use iFocus. Our experience shows that patients respond better if iFocus is mentioned during the appointment. We recommend discussing iFocus as part of the medication discussion. Then share with us feedback and suggestions about how iFocus helped you and your patients, as well as what you would like to see in the reports. We can support by providing flyers, hard or soft copy. Now I want to show you a bit more information about our research, data, and a bit of what's behind the scenes. We completed the study with 100 participants. All reported they have ADHD and that they have been stable on stimulant medication for at least 6 months. They also reported medium to high satisfaction with their medication. The study was conducted remotely. Patients participated from their home using their own webcams and computer. Each patient completed at least 2 sessions without medication and 2 with medication. These are the results of the study. Part of the data was used to train our algorithm, and here you can see the results from testing it. The top graph shows the different scores by group. The bottom graph is basically the same data, but where we connected each patient with their own data. 83% of patients showed improvement in the study. The study was published in the peer-reviewed journal on the Journal of Attention Disorders. These are the building blocks of iFocus. We partnered with UMove, who developed leading technology that enables using standard webcams for eye tracking. No specialized equipment or calibration required. Our AI algorithm uses eye tracking information to analyze the changes in reading patterns compared to the patient's baseline and provide performance improvement scores. And this is an important point. We're not diagnosing, we're not comparing patients to the normal distribution. We're comparing each patient to their own baseline. iFocus gives real-time measures of performance in real-life tasks without disrupting real life. As I showed in this presentation, this can significantly improve the titration process. However, we wanted to explore additional use cases. For example, the ability to measure the effects of medication at different times of the day. This plot is based on one-time test I performed on myself. It is not yet a full study. However, it shows how Vyvanse's medication affected me over 1 day. In this case, the medication took longer than expected to reach its peak effectiveness and had an effect for over 13 hours. As mentioned, this is 1 day for one person, so this is not a statement on how this medication works. However, I can share with you that this is aligned with my personal experience. I find the mornings harder than they were with other medication, but I can keep going till later at night. I can also share that I expected and wanted the score to increase earlier in the day. However, since we only partly control our eyes, I could not affect the result. Thank you for taking the time to learn about iFocus. I look forward to hearing from you. Feel free to reach out with any questions or if you're interested in joining our pilot program.